speaker, Dr. Neha. I request all the presenters to please remain till the end of the session because this is Cornea 4 and will be followed by the semi-finals. So please make sure you're here.
Good afternoon, everyone. I am Dr. Neha SAPAR. I'll be presenting my study on drop count and volume of commercial moxifloxacin drops and its implications in keratitis treatment. We begin with the case of a 50-year-old woman who presented to our OPD with complaints of redness and irritation in her right eye since 2 days. And on initial clinical examination, we found this clinical picture. And we started her on empirical therapy of hourly moxifloxacin eye drops and called her for review after 1 week. On her follow-up visit, we saw this clinical picture and questioned her about her drug usage. On questioning, we found out that since she had exhausted her supply of medication in 2 days, and since she stayed at a very far away distance, she could not refill her prescription and stopped using the eye drops after 2 days. So this led us to our research question: are there adequate drops in a bottle for a week's treatment? So if we calculate the hourly usage for 1 week, it comes to around 126 drops. So on going through existing literature, we found out that fill volumes of topical anti-glaucoma medication, steroid, and NSAID eye drops have already been studied, but there is no existing study on the number of drops per bottle in antibiotics. Our primary objective was to calculate the drops per bottle of commercially available moxifloxacin, and a secondary objective was to calculate the mean drop volume and the cost estimate of treatment of bacterial keratitis with moxifloxacin eye drops. So we took 3 bottles of each brand from commonly available brands from our hospital pharmacy. We blinded each bottle with a black tape and labeled them from 1 to 12. 3 independent mass observers evaluated the drop count. They expressed the drops by holding it with their dominant hand at a 90-degree angle, and we gave them 3 bottles per day to prevent hand fatigue. So the most common prescription for moxifloxacin for the treatment of bacterial keratitis is hourly, which is 18 times a day for 2 weeks, followed by 6 times a day for the next 4 weeks, which comes to around 420 drops. So we found out there was a great variation in the drops per bottle, as we can see, the drop volume, and also the cost of treatment of bacterial keratitis. To summarize, the drops per bottle varied from 104 to 174. The drop volume varied from 29 to 48 microliters, and the cost of treatment varied from rupees 185 to rupees 1,536. So we found that only 4 out of the 12 brands had adequate drops for a week's treatment, and premature exhaustion of the drops could lead to poor compliance and serious visual outcomes. So this variation is mainly due to the different drop volume. And also it is pertinent to note that the conjunctival cul-de-sac is only 30 microliter. So any excess volume will only be wasted. It won't be of any use. And larger drop size does not lead to better treatment. There are various factors which affect the drop size, such as the dropper design, the surface area of the orifice, presence of an annular orifice, physicochemical properties of the solution, such as viscosity and surface tension. Greater surface tension leads to larger drop volume. And also patient usage characteristics, because according to a study by Ikeda et al., they found that only 70% of initial attempts lead to successful installation in the eye, and also the way in which the patient will instill the drops into the eye, these can also affect. Other similar studies, Heath et al. studied NSAID eye drops, and they found that fill volumes and patient incurred costs varied significantly. Another study by Gill et al., they studied steroid medication, and they found that all the formulations covered post-operative periods for cataract surgery. The limitation is the limited sample size due to cost constraint, and we did not calculate the force required for dispensing the drops. To conclude, this is the first study estimating drop count and its cost implication in antibiotic eye drops, and understanding the drop count can improve compliance, and also we can set realistic expectations for the patient regarding medication adequacy and the need for extra bottles. Thank you.
So one question, so when the bottle tip was open, nozzle was open, so how was it open? Because even that will have, there are a lot of variabilities I realize would be with the, drop, number of drops. One is the pressure, what you apply, one is the nozzle,
Yes,
how, what the caliber, opening,
yes,
all these are the variabilities, and whether it's only one person who's doing that. and
three,
whether
ma'am.
it's-
Three people.
Because there's a fatigue sets in.
Yeah,
and
yes,
all
ma'am.
those
So
things
we
are also
gave
there.
them.
So,
Yes, ma'am. We
so
gave
tip,
them.
what is the what was
Ma'am, the bottle itself will have the.
with that it was
With
done.
that itself, yes, ma'am. And some bottles will have like the hole will already be there. So we didn't mention that in our study, whether it was the hole was already present or it was. We didn't study that, ma'am.
Have you counted for day and night also? 24 hours counted?
No, ma'am.
Huh.
Just 3. It doesn't take
Only
much
in
time, ma'am.
daytime.
Just maybe 10 to 15 minutes, ma'am. Just 3 bottles per day. So